For the final recording in this course, we will cover two intestinal apicomplexa. They are Cryptosporidium parvum and Isospora belli. To start, Cryptosporidium parvum is a self-limiting gastrointestinal parasite. It is transmitted by the fecal-oral route of transmission, so man gets it by ingesting contaminated food or water that contains the parasite. There are sexual and asexual reproductive stages that occur with this parasite, but we're not going to go into them in any detail. So if an immunocompetent person were to contract Cryptosporidium parvum, it would be GI disturbance, but it would be self-limiting. So it might last a couple weeks, typical diarrhea, but and maybe some dehydration. But with immunosuppressed patients, especially AIDS patients, this can be life-threatening. So this is considered a common opportunistic infection for this population. So for them, it's cholera-like symptoms where it's severe vomiting, severe diarrhea, really bad dehydration, and mucousy stools. Man gets infected with Cryptosporidium parvum by ingesting the infective oocyst from contaminated food or water. So this is the infective stage for man, ingesting the oocyst. And this is the thick wall oocyst makes it environmentally resistant, and it is infective when passed. So it doesn't need to go to water or the soil or anything like that to mature. It is infective when passed from the infected human. And this is another common waterborne parasite that is often seen with Giardia. To diagnose can be fairly difficult because of its size. It is very small, only 4 to 6 micrometers. And it's round. It's not really anything remarkable looking. It resembles yeast, or even that's about the size of a red blood cell. The normal trichrome or iron hematoxylin stains that are routine for parasitology are not very helpful. So if the doctor suspects this, we need to do a different stain. We need to do an acid-fast stain. And things that are acid-fast means that they're resistant to the acid decoloration that's used in the staining procedure. So this organism will stain bright red. Things that are acid fast stain red with the Ziehl-Neeson acid fast stain. In contrast, yeast will stain green. So that's how you can distinguish the two. And there's also an indirect IFA test you can do to detect the antibodies to Cryptosporidium parvum. So this is what it would look like in a positive acid-fast stain. So you see the red circular organisms here. These are the oocysts for Cryptosporidium parvum. This is your diagnostic stage. So you would be told this is an acid-fast stain, and you would need to give the genus and species. Isospora belli has many of the same symptoms as Cryptosporidium parvum, although it's less frequently seen than Cryptosporidium. Man gets infected by ingesting the infective oocyst as well. So the same name for the infective stage for both of these organisms. However, this is not infective when passed. The oocyst must mature for a day or two after being passed for it to be infective. Now, diagnosing is also similar to Cryptosporidium parvum in that we can use the acid-fast stain for this one as well. But we could also see this in a wet mount, so we'll see what it looks like stained and unstained. The diagnostic stage is also called the oocyst, just like Cryptosporidium parvum, but this has an immature form and a mature form. So the immature oocyst is oval with one single sporoblast inside, whereas the mature oocyst is oval as well, but it contains two sporocysts. So these are the more mature forms of the sporoblast. In the immature sporoblast, in the immature oocyst, you have one sporoblast, then that will divide, in which case we have a mature oocyst, and they're now called sporocysts inside. The acid-fast stain is helpful, and this is a larger parasite to see. You really won't miss this. It's large and it can stain that dark red again with the same acid-fast stain. But we could also see it on our wet mounts. So this would be called the immature oocyst. It's oval, and inside we have one sporoblast. Here is a mature oocyst, and inside we have two sporocysts. Here's another one, same thing, and this would be an immature oocyst with one sporoblast inside. And here's what it looks like stained with the acid-fast stain. So staining bright red or pink. This would be an immature oocyst because inside it just contains one sporoblast.